Welcome to Science Force, where science comes alive.
Welcome to this explainer. Today, we're diving straight into a profound physiological mystery, rheumatoid arthritis. Seriously, if you're into human physiology or a biochemistry major looking for some wild biology facts, this one absolutely commands your attention. We're looking at a devastating scenario where the body's elite defense force, the immune system, just completely gets its wires crossed and goes rogue. We're going to break down exactly how this betrayal happens, literally step by microscopic step. The roadmap. So here is our roadmap for today. 1. When immunity goes rogue. 2. Inside a healthy joint. 3. The anatomy of an attack. 4. The systemic fallout. And 5. Detection and defense. Part 1. When immunity goes rogue. To really grasp the massive scale of this condition, we've got to clarify what it actually is. Let's clear up a huge misconception right off the bat. When a lot of people hear the word arthritis, they immediately think of osteoarthritis. You know, the mechanical wear and tear of the joints that just kind of happens to us as we get older. But rheumatoid arthritis, or RA, is fundamentally different. It's actually a chronic, systemic autoimmune strike. It's an inflammatory disease driven by an abnormal immune response that specifically targets the synovial membrane. So this isn't just about aging joints. It's a highly coordinated biological misfire. And the global scale of this? It's massive. Roughly 0.5 to 1% of the entire world's population faces this internal rebellion. We are talking about millions upon millions of people. And interestingly, it has a really marked predominance in women, affecting them 2 to 3 times more often than men, which is likely tied to some pretty complex hormonal influences. Moving on to part 2, inside a healthy joint. Before we get into the pathology of how things go wrong, let's establish our baseline of peace, so to speak. Okay, so in a normal, healthy synovial joint, you've got bones meeting at a joint capsule, you've got protective cartilage covering the bone surfaces, and ligaments and tendons keeping everything nice and stable. But what I really want you to focus on is the synovial membrane lining that capsule. See, its only job is to be a quiet, helpful tissue that produces just a tiny bit of synovial fluid to give you frictionless lubrication. It's perfectly designed to be this peaceful little supportive structure. Which brings us to part 3, anatomy of an attack. Let's see how this peaceful state turns into a microscopic battlefield. This is where the biochemistry gets truly fascinating and, honestly, destructive. We've got 4 biochemical stages of pathogenesis here, outlining this tragic cascade. It takes us step by step from the initial immune system activation straight through the synovial inflammation phase into the formation of a dangerous tissue mutation called a pannus, and finally, right down to catastrophic joint destruction. Let's walk through exactly what's happening at each step. Step 1. Activation. The inciting incident requires a perfect storm. You need a genetic susceptibility, specifically carrying genes like HLA-DR4 and HLA-DR1. But here's the thing, genetics alone usually aren't enough. You have to combine those genes with an environmental trigger. Cigarette smoking is actually one of the strongest known risk factors. Or it could be certain viral and bacterial infections. Whatever it is, that combo lights the fuse. It convinces your elite immune cells, your T cells, B cells, and macrophages, to suddenly look at your perfectly healthy joint tissue and say, hey, that's a foreign invader. Step 2. Inflammation. Once activated, these immune cells just flood into that previously quiet synovial membrane we talked about. Now, for the physiology buffs out there, here's where the cellular communication goes completely haywire. The immune cells start firing off massive amounts of cytokines. Think of cytokines as chemical flare guns. We're talking about tumor necrosis alpha, interleukin-1, and interleukin-6. These flare guns sound a massive alarm, calling in even more destructive reinforcements to the joint. And it just creates this vicious, self-sustaining loop of intense inflammation. Step 3. Pannus. Because of that relentless cytokine storm, the synovium is literally forced to mutate into something villainous called a pannus. Now, this isn't just everyday swelling. A pannus is an abnormal, thickened layer of inflamed tissue that physically invades the cartilage. It erodes the bone, it damages the ligaments, and severely restricts movement. It behaves almost like a localized tumor, relentlessly expanding and destroying the architecture of the joint. Step 4. Total joint destruction. We need to zoom back out from the microscopic biochemistry to the macro level to see the physical consequences of this sustained attack. Without treatment, that persistent inflammation and that aggressive pannus just chew through the cartilage and weaken the tendons. Eventually, the biomechanics of the hand completely collapse. Swan neck deformity. Because the joint structures are eroded, the middle joint of the finger essentially hyperextends and bends backward, while the fingertip is forced to curl inward. Boutonniere deformity. The compromised ligaments permanently force the middle joint down into flexion, while the fingertip points awkwardly up. Ulnar deviation. As the ligaments at the knuckles become extremely lax and damaged, all the fingers chronically drift outward toward the little finger side of the hand. It severely impairs a person's ability to do basic everyday things, like holding a pen or buttoning a shirt. But remember what we established right at the beginning. RA is a systemic disease. The fallout goes way beyond the joints. Those inflammatory cytokines circulating in the blood threaten major organ systems. Skin, firm rheumatoid nodules forming under the skin. Eyes, severe dry eyes and scleritis. Lungs, pulmonary fibrosis or pleural effusion. Blood, anemia of chronic disease, and elevated inflammatory markers. Patients experience profound fatigue, fever, and weight loss. Heart, the cardiovascular system is under siege. RA causes accelerated atherosclerosis and pericarditis, making cardiovascular disease a major cause of mortality here. It is truly a full-body crisis. Finally, Part 5, Detection and Defense. I know this all sounds incredibly daunting, but let's look at how modern science fights back, because our tools today are nothing short of remarkable. Diagnostically, doctors have some very powerful blood tests to rely on. We have ESR and CRP, where elevated levels indicate the active presence of systemic inflammation. We have rheumatoid factor, or RF, which is present in about 70 to 80% of rheumatoid arthritis patients, though it can sometimes show up in other diseases. But the real game changer for rheumatologists is the anti-CCP antibody test. Unlike RF, anti-CCP is incredibly specific to rheumatoid arthritis. If a patient tests positive for this antibody, it strongly supports the diagnosis, allowing for rapid intervention. And rapid intervention is absolutely crucial. Once detected, the immediate hero of this story is methotrexate. It's the cornerstone of a class of medications called DMARDs, or disease-modifying anti-rheumatic drugs. Methotrexate doesn't just mask the pain, it physically alters the physiology of the disease. It reduces the inflammation, prevents that joint-destroying pannus from doing its worst work, and dramatically improves long-term outcomes. And for the most aggressive cases, science has engineered biologics. These are absolute marvels of modern biochemistry. We're talking about therapies like adalimumab, etanercept, and infliximab. Remember those specific chemical flare guns we talked about earlier? These biologic drugs act like snipers. They're designed to target highly specific inflammatory pathways, neutralizing those exact destructive cytokines, cutting off the communication lines of the rogue immune cells, and halting the destruction in its tracks. Which leaves us with a pretty provocative thought to ponder. We've seen how RA begins with this complex mix of genetics and environment, leading to a devastating systemic attack. But as our biochemical tools become incredibly targeted, are we closing in on a world where autoimmune diseases are simply switched off before the damage even begins? It's a thrilling frontier in science, and one we'll definitely keep exploring. Thanks for joining me on this explainer.
Thank you for watching Science Force.